Welcome to our Natural Health News live show. For all of you joining, good, happy Saturday morning here. We have Instagram Live and YouTube, and I have a ton of news, really important, hot off the presses, studies, research, some really interesting findings that I think are quite impactful in terms of how we are approaching our reopening processes and procedures. And then I've got some statistics on who all is most impacted, races and ethnicities specifically. So we'll talk about that. Welcome all of you joining. It's Saturday morning. Woo! Yay, it's a weekend. I know every day sometimes seems like Groundhog Day. And Brian sings the song from the movie quite often. I think he's watched the movie like 4 times since we've been in this. But at any rate, tell me where you're tuning in from. We have a very large international community. So I love to see who all is joining us, what countries you live in. And today I'm going to report a bunch of news that will impact everybody all over the world. So right now, let's dig into some of the data. So we'll talk about COVID news, and then we're going to specifically in today's video talk about some tools, some home healthcare resources that it's a good idea to have on hand. Given some of the new data and new research I'm going to report about, I want to make sure you guys are equipped and have all the resources you need at home to monitor your health, because there are some findings about the asymptomatic cases that are pretty alarming. And there are some indicators that their body is presenting with some evidence that we need to be able to monitor this at home. So welcome all of you. Okay, so here's our news. The world is at 6.759 million cases. So 6,759,000 cases. We globally, we are seeing just an overwhelming amount of deaths. So we have over 400,000 deaths from COVID-19. Brazil really took a big jump. So they jumped over 28,000 cases. They're at 646,000 cases. Russia's at 458,000. And India is on the incline. India surpassed Italy in total number of cases. India is at 237,000 cases. Now, Brazil has joined the Oxford vaccine trial because of the quantity of cases and the great explosion of the situation there. They also are short-staffed in terms of the healthcare professionals. So they're joining the trial, and that might help at least expose the vaccine to the growth there. The U.S. is almost at 2 million cases. So we have 1,936,000 cases. New York saw the lowest day of deaths since the beginning of their peak, or the beginning of that major incline. So New York's at 376,000 cases. New Jersey, 163,000. Illinois is up to 125,000. California is at 122. Massachusetts is at 102. Pennsylvania, 74. We have Texas at 71. And Texas, I want to highlight, I know I have a lot of you watching from Texas. Harris County is one of the largest counties in the U.S. And Dallas County and Harris County both have had some really substantial increases. Dallas County had over almost 300. There were 2 people shy of 300 new cases in one day. That's their single largest day of positive cases in that county. Harris County also has 180 new cases one day. And they are not necessarily sure if this is attributing to some of the protest exposure, or more than likely is what they've commented is that this is the 7 to 14 days after the reopening. And so Texas is definitely in that reopening phase. Speaking of reopening, Florida, 61,000 cases. They've crossed that 60,000 threshold. They're surging, as yesterday was phase 2 of their opening, where tattoo parlors, acupuncture, massage, more kind of enclosed like gyms, bars, things like that are starting to reopen. Florida has had their third consecutive day of high numbers. And in total, Friday, they had almost 1,500 new cases and 53 deaths in one day. And this is the single highest number since they started tracking COVID. The big thing that I want to highlight, many of you know, if you're new joining, I grew up in Florida. I was born in Georgia, grew up in Florida, and now we're back in Georgia. The county where I lived in, grew up in, and started my business in, they had 85 cases yesterday. And that is a major, major peak. So I'm seeing lots of things on my social feeds from my friends and fellow business owners and entrepreneurs down there, very much concerned about this. And also commentary that they're out and about and people are not wearing masks. And even somebody said, oh, are we still doing that? I guess he was going the wrong way in Trader Joe's. And he asked, oh, are we still doing that? Like the virus is completely gone. I mean, we have amnesia and we have like the attention span of gnats when it comes to this virus. It's not funny, but it's one of these things, like if the news stops reporting it or they're pivoting on other very important news, people just kind of are in denial, it seems like. So some other states, Michigan's at 58,000, Maryland 56, Georgia is at 50. Georgia's seen some spikes as well. Virginia is at 48,000, and I'm monitoring Minnesota. They're at 26,980, almost at 27. And I'm going to look back because, you guys, this is my COVID journal. Literally every day I've taken notes. These are our show notes. I've been doing this. I'm almost at the end of my notebook. And this is my cute notebook. Isn't that great? Nice little Zen hand. It says, every morning we are born again. What we do today is what matters most. Buddha. So I think that's a great quote I wanted to share with you. But let me look at the Minnesota. So 3 days ago, Minnesota had 25,870, and now they have 26,980. So that is definitely a almost 1,200. Yeah, almost 1,200 case increase 2 days. So that's a lot. So we're going to monitor that because we know that was a growing area. There were some epicenters, and potentially some of the protests could be part of that. Now, the other thing that I want to highlight is that there was a big journal, an article. There are a lot of articles, but a big one came out in the European Heart Journal this week, and it highlighted that of all the COVID patients that have had escalated conditions, had needed hospitalization, ICU, and even those who have passed from the virus. Particularly half of the patients who have died have had high blood pressure. So that is significant. Over 50% of Americans have high blood pressure. That will be something we're going to discuss. In my show notes on YouTube, I have some recommendations for supplementation that I routinely take to manage my own blood pressure, but I definitely want to highlight that. This is a critical underlying health concern, and we're seeing that be one of the leading health conditions, underlying conditions. Now, I also want to highlight that the World Health Organization finally has come out and made recommendations that everybody should be wearing masks. We kind of see the CDC's come along a little bit, and then we're seeing, the World Health Organization. I've been reporting to all of you just the amount of information. There's more and more data coming out showcasing the reduction of transmission, particularly the asymptomatic cases, which will have a major impact when I share this news with you. But their recommendation, everybody should wear masks. You should be wearing fabric masks when there is widespread COVID. So for instance, Florida, Texas, California, Massachusetts, all these states that I recommend, even Minnesota, all over there are pockets, Arizona, particularly Arkansas, Alaska. We should be wearing masks. And they have identified 3 layers. They've gotten way more specific than I've seen anybody be specific. An inner layer should be cotton, so it's breathable, wicking, and it can hold moisture. A middle layer, that's a filtration type of layer. And then an outer layer, they recommend water-resistant materials. I think if you have a 5 carbon layer filter, you achieve that if you have that insert in your mask. And I have one of my friends, and she's been a customer patient of ours. her and her mom love them. Sarah is making masks, and she's doing 2-layer masks with a filter insert that you can, she has an insert or an option for you to be able to insert a filtration. So that is critical. And the CDC has also put out some additional information. And this is, oh man, this is craziness. So there's a lot of, I printed it. So yesterday, they used to be really routine. Like every Wednesday, they put out their MMWR. They're not doing that as routinely. But the MMWR, the CDC Morbidity Mortality Weekly Report, they actually highlight some crazy information. The title of this piece is Knowledge and Practices Regarding Safe Household Cleaning and Disinfection for COVID-19 Protection. What they go into is actually an insane amount of people who are using cleaning disinfectants orally. They're either gargling with bleach or some sort of household cleaner, or they're swallowing it. I mean, I'm not kidding you. This is the breakdown. 502 people interviewed and I highlighted in the study. 20 people, 4%, have affirmed that they either drink or gargle with some sort of household cleaner. 18%, like crazy, 90 people, 18% have applied disinfectant to their skin, thinking that this would prevent COVID. I mean, we're talking about COVID specific. This is their methodology. 10% have actually inhaled the fumes, thinking that that would reduce COVID spread. And the average age is 46, group of 18 to 86-year-olds, pretty substantial. And these respondents, they engaged in high-risk practices. They did it because they had heard on TV that that was a recommendation. We all know, I've highlighted that. I'm not going to get into politics, but we definitely have heard individuals ask if that's possible. So, the dogs are playing tug of war. But this really highlights just how we need to be educating more and more people. We did see spikes of folks that had ingested bleach. One gentleman, I think I reported, he drank like 32 ounces of bleach. I don't even know how you get that down. That's not just one gulp. So that's the latest report from the CDC about individuals and their kind of processes. I do want to report some testing. There are still pockets in areas where we don't have all the materials for test kits. For example, we had the administration go to a nasal swab factory, I guess on Thursday or Friday, in Maine. And these nasals, like Maine is deficient in testing supplies, and they need these nasal swab, these like little cotton balls at the tip of the nasal swab. Well, apparently Puritan Medical has announced that all the swabs that were in production, like they visited the production line, everything that was produced in the time of the visit has to be thrown away because not all the right parameters were taken for safety. And that's unfortunate because they need all those supplies. But that is a tell. We still are lacking in PPE. We're still lacking in those materials. And also the CDC has released additional data about the testing. We still are lacking some testing. I do want to highlight the CDC posted for the specifics of age-adjusted COVID-19 associated hospitalization rates by race and ethnicity, just to highlight racial disparities when it comes to COVID. So we have, this is the chart. And so this is from March 1st to May 23rd. The blue, this dark blue, basically they're tied. Dark blue, non-Hispanic, American Indian or Alaskan Native. And the second one is non-Hispanic Black. Okay, so this chart, this line, this bar graph here, these cases are not even included. So Native American, Native cases are not included in our number count. We have no sort of substantiated quantity of daily assessments of our Native American tribes and the population density with this. We've had some offhanded reports I've reported to you, but they coincide. So Native Americans, 142, and then we have non-Hispanic Black, 142. And then next we have Hispanic/Latino. And then, I mean, what a major drop, 108 down to 35. This is non-Hispanic Asian or Pacific Islander. And then 31 is non-Hispanic white. So if anybody has any doubt as to COVID and the disparities of COVID in race and ethnicities, this is the data, friends. This is calculated data based on hospitalization rates. So we are seeing certain ethnicities and races be greatly impacted. And this is a much bigger picture we need to talk about, but I want to highlight that. The other thing too, let's talk about age. So this is another thing in the report. Age-wise, number of cases. So traditionally we've been told, oh, it's an older person's disease. Nope. Look at this. 18 to 44 is the highest amount of individuals who have been tested and tested positive. And then the next 45 to 64 is next up. So if you are in between the ages of 18 and 64, the likelihood you have a greater probability of having COVID than you do past the age of 75 and also younger. Okay, so I just want to highlight this. This is really critical because there are a lot of folks, 22-year-olds, 26-year-olds think they're totally fine and are free of COVID, and that is just not the case. There has been a warning specific about, and I don't know if I printed this. So the CDC released information from South Korea. So South Korea did a study, and I thought I had printed out. Maybe I didn't. Sorry, you guys. I had a lot to print out. The CDC released data from South Korea where they assessed group fitness activities, and they wanted to identify, is it okay to be in a gym, workout group program, group workouts, then the differences between outdoors and indoors. And basically what this did, the study analyzed large classes in small spaces with poor ventilation, no HEPA filtration, and charted the growth and transmissibility of COVID. And in fact, they found that in smaller enclosed spaces with poor ventilation and larger class sizes, like 10 or more, that either the teacher and or the class participants ended up having transmit or they came into contact, and there was transmission of COVID in these environments. And so the recommendation is a warning against these group fitness activities. And many of you guys know I was really doing a whole lot of pre-wedding prep. So I was working out at a gym. It was a 3-part, 20 minutes on a bike, 20 minutes in like high intense cardio, like weight training stuff, and then yoga. And each of those little blocks was a small enclosed space. And they have since limited the class. But what this was showing is that even working out, like there's hyperventilation and there's an increase in the respiratory particles from fitness, and that being outside, like continue your workouts outside, run outside. Even some of those like CrossFit gyms that are in and out, they're now only outside. That's a much safer setting than an enclosed space. So I wanted to highlight that for all of you who are like me, itching to get back into that zone. It's not safe, especially when you're in those programs. You're not, the likelihood, like it's not exactly an awesome thing to be wearing a mask, and especially like when I was doing the bike, I would be drinking a lot and, toweling off because I was sweating. It's just not always feasible. The other thing the CDC did put out, and I'll just kind of highlight this real briefly. It does have some information about transportation. So as things get back to normal, there's more public safety measures regarding public transit. They got rideshare taxis, limo for hire, so like Uber, shared bike, scooters, other motor mobility devices, personal vehicles, and then also for people who are bus drivers and public transport. So they've got a lot of information in terms of just the kind of guidelines. It's just a minor kind of guideline assessment. So let's talk about the major news. So this was the article from the the European Society of Cardiology, the European Heart Journal, an assessment of hypertension in COVID cases. 50%, up to 50% of COVID cases. Half of the patients who died had high blood pressure. So us managing this is going to be critical, meaning one of the tools you're going to need to gather is everybody should be taking their blood pressure. You should do it anyway, especially ladies, okay? Like the only time we traditionally get our blood pressure taken is when we go to the doctor's office. If you're like me, I have total white coat syndrome, and it's not always the most accurate. There's a lot of variables. I did a video on this earlier this week, so please watch it. But most specifically, we need to know your non-freaking out white coat syndrome, nervous about some other condition or whatever. We need it outside of that normal kind of clinical setting, and we need it in your regular day-to-day life. And this is a way to monitor and manage diseases that are very much in our control, but we need knowledge. So that we'll talk a little bit more about. But this is a June 3rd article that came out in the Annals of Internal Medicine, and it's a prevalence of asymptomatic SARS-CoV-2 infection. Okay, this is a game changer for what we know. This publication talks about the spread of coronavirus is linked to asymptomatic carriers up to 40 to 45%. 40 to 45% of the spread has been from asymptomatic carriers. And they actually go into a whole bunch of assessments. They look at Iceland, they look at Italy, they look at the Diamond Princess, they look at different cases. They look at data we know from the Boston homeless shelter, the Los Angeles homeless shelter, the New York obstetric patients, the USS Theodore Roosevelt, the Charles de Gaulle aircraft carrier. They look at Chinese citizens evacuated from Wuhan. And they literally look at everything. Greek citizens that are evacuated from Spain, Turkey, and the UK, nursing facility residents in King County. They look at inmates in Arkansas, North Carolina, Ohio, and Virginia, Rutgers University, their students. Indiana, Argentina, the cruise ship passengers and the crew, San Francisco. They look at a lot of data points. And basically the likelihood that approximately 40 to 45% of those infected with SARS-CoV-2 will remain asymptomatic suggests that the virus might have greater potential than previously estimated to spread silently and deeply through human populations. That is significant. And this is why we've slowly seen the CDC get on board with face masks. This is also why we've seen now, yesterday, as of the announcement, the World Health Organization is recommending facial masks, fabric masks. Now, this is critical. This also assesses some information about these patients that are asymptomatic. They also talk about CT scans. So these individuals have CT scans of their lungs, even though they're asymptomatic, not showing any type of overwhelming symptoms of the virus, but their body has been impacted. They look at the Princess Cruise Line specifically. So the Diamond Princess Cruise Line, let me pull them up. So this is back in February 3rd. So on February 3rd, the Diamond Princess cruise ship, they're the ones that docked at Yokohama, Japan. They were in quarantine, and then they had transferred, before they docked, they had transferred out some patients over on the shores of Hong Kong. So when they were outside of out of Yokohama, Japan, and by the way, I live like 20 miles northeast of there when I lived in Japan for a year. So they were docked from February 3rd to March 16th. 712, 19% of almost 30, just over 3,700 passengers and crew had tested positive. At the time of testing, 331 had positive results. So 46.5% of the people tested positive had no symptoms. They are asymptomatic. But these, it says, although the latter infected persons reported no symptoms, some of these individuals actually had some subclinical changes in their lungs. This is amazing. When computed, so when they actually had the CT scans, they did CT scans of 76 persons. 54% showed lung changes in the texture of the lung itself. So there was lung damage demonstrated. That is huge. And I don't know if this will get buried. I don't know if this is going to get picked up in kind of the regular kind of news information. But the fact that asymptomatic cases, no symptoms, no bronchial issues, no cytokine storm, nothing involving even like sore throat, swollen nose, any symptoms that we would traditionally measure, these individuals not only are spreading it, but their body is actually having damage done by the virus, even without symptoms. It is huge. I see that, Lori P. It's huge. Linda Strickland, that's huge. It's huge, which means we have got to really get clear on the use of face masks. And I mean, I have these, I have Sarah's, I've got it in my car. I also, and I've got it posted, links down below, where you can buy N95 masks, and they do come. I had just 15 arrive earlier this week. It becomes critical. Everybody that we know who's encountering people in a social setting, in a work setting, need to be wearing masks. If they don't have them, and maybe it's financial, or they don't know the access, or they just don't know this type of information, we need to help them. We need to get them masks. I have a little kit outside, like literally just like on the other side of this wall is our front door. And I have a little stand where I have snacks, I have goggles, I have hand wipes, I've got the handsies we give out to them, and I have face masks and hand sanitizer. And that is something that all of my FedEx, my UPS, and I get a lot of shipments with work as well here. So we have home and my work all combined. So there's always something being delivered. Our postal service worker, she's finally back. I need to send her a message and find out if she's okay. But our regular mail carrier was out for like 2 weeks, almost 3 weeks. So at any rate, this is absolutely critical. The other thing, here's some other news. So the assessment of the Teddy Roosevelt. So remember they were out in the Pacific. This was an American aircraft carrier where they had diagnoses on March 22nd. So towards the end of March. And then fast forward a month later, a full month, almost 5,000 members had tested positive, or sorry, not 5,000. It was almost 5,000 member crew, 856,000. So about 17% had tested positive. According to the news report, 60% of those positive cases were asymptomatic. But this is what's interesting. Traditionally, we have thought that the transmissibility is about a 14-day window if you're positive. This says after an extended period of isolation, many of these asymptomatic persons continue to test positive. So, and apparently there's an internal US Navy document stating results of out-testing portions of the crew following 14 days of quarantine leads us to reevaluate our assessment of how the virus can remain active in an asymptomatic host. That's big news, big news. So let's just say, for instance, and don't take any of this as me being negative against protesting. I am a huge supporter of the First Amendment right to voice our opinion. As you guys know, I get frustrated with YouTube locking down some of that, especially with what I do, because I'm so above board with all of our data information. But let's say you are inclined because you're so frustrated by the ridiculousness that's taking place. you're going to need to go and protest. Let's say 3 weeks ago, you had a positive test. You've done your 14 days of quarantine and you're like, I'm all good. They said 14 days. Research shows 14 days. Ding, ding. That's not always the case. And the USS Teddy Roosevelt shows us that that is not the case, that those individuals, and I don't know, we don't know yet why. We don't know how expansive this is. We don't know how many of the cases that if you're asymptomatic, how long it plays out. We do know that there are instances where people are hospitalized, they have 2 negative tests, they go home, and a month later, they're having symptoms again. They come back and they test positive. Were those false negatives? Was this just an incubation? Were they exposed to a different strain? Who knows? But this is really telling. We still don't know enough. And the fact that we are reopening, we've got people, doing fitness classes. We have people shopping and thinking everything's back to normal. Florida is having an extensive amount of cases. We're seeing also increases in Texas and other communities. I'm talking about Arizona, Arkansas. There's 18, I think I reported yesterday. Let me go back to yesterday's notes. I reported 19 states have had more cases this week than last week. 19. That's a lot. So that is really telling. Now, the other thing that this study, this is a keeper for me. This is a really big foundational piece. It also identifies that in asymptomatic cases, one of the underlying currents that they see is a change in heart rate. Okay, so again, one of the tools that we want to use, not just pulse oximeters. You can have a pulse oximeter and get your heart rate. You can also have your blood pressure cuff and get a heart rate. Either one of those would be fine tools to have. And I have links down below where you grab those. They're all reputable. I've purchased items from them. I've tested them out, so don't worry. For the brands, they're wonderful. What we need to consider is that the elevation in the heart rate is synonymous with an asymptomatic case. And this is one of those things. You might be fine, no traditional symptoms, but who's evaluating the heart rate? Not everybody can tell, or be tuned in when their heart rate is elevated. And it could be a 10-point elevation. It could be a 20-point elevation. It's not one of those things where it's going to trigger, oh my gosh, I'm having a panic attack type of elevation. If your resting is 68, now you're at 88, you might feel a little different, but it's nothing major. You might not register it. So elevations in heart rate are something that we need to assess. And that is really what I wanted to talk about today, are tools that you can have at home to help you evaluate if you are asymptomatic. Linda, DM me. I don't always have, I'm not always tuned into who all wants what, or you can just run to, actually, hold up. I'm very excited to announce Instagram, for, I don't know, whatever reason, maybe it's a new upgrade that I did on my phone, but now all of my live shows are housed permanently on Instagram TV. It's letting me go beyond 9 minutes of airtime. I don't know if it's because I'm considered a creator or what, but whatever. The good news is the links I'll post the links on the IGTV and it goes up on my feed. So give me 20 minutes or so for the YouTube stuff to get up, and then you can watch on the feed and you can get links there. So that's exciting. Even though we've gone down, I'm not yet at 10,000. I hit 10,000, then I've gone down. So hopefully this weekend we'll hit 10,000. I have a cute little photo shoot to share with you guys that we did in our cute little mini pool in the front yard. But at any rate, here are things that you want to have. You want to have a blood pressure monitor, and please get them. If you have any family history of heart disease, high blood pressure, heart attacks, stroke, you yourself are concerned, you have white coat syndrome like I do, and it's really elevated when you're at the doctor's office, get this. Because a lot of times with those elevations that you see, not every doctor, if you're seeing a GP or internist, none of them are going to say, let's monitor your blood pressure over 2 weeks and see, is it white coat or is there an underlying condition? We need to evaluate how we're monitoring our health. And especially now that we know asymptomatic cases demonstrate lung disease in a certain percentage of those individuals. And we know that half of the deaths of all COVID patients, half of those patients have had high blood pressure. This is critical. This is an absolute essential item. And now knowing Asymptomatic carriers, one, have elevations in heart rate. Two, might be they might be still contagious after 2 weeks. These are some tools that we can use. And that is absolutely, this data is mind blowing. I don't know if it's blown your mind as it did me, but I was like, whoa, and I can't wait to share it with you. Okay. Let's see. Let me look at some information and some news here. Some questions. Okay. Yeah. So Kay Jefferson, that's scary. Although I do know people who spray themselves with disinfectant spray. That's craziness. I mean, to be honest with you, the spray that's okay to use on your body is Force of Nature. These guys are a great brand. And if I don't have them linked, I'll make sure I post this. This is okay. You can spray on your body, but it's water and it's vinegar and salt and it's electrolyzed. And this solution becomes something you can spray right on your skin. That's the only thing I would recommend have on your hands. So Queen of Sheba, so Native Americans don't count. Apparently, for whatever reason, and I think part of it's because each cluster, each tribe is considered its own nation, and thereby they're not technically reporting it. I mean, it is insane that we are not seeing those cases. And the fact is, I mean, I think the other thing we have at play is we have a desire to keep the numbers low, to present that we're okay. I mean, if we see, and we know like at least the numbers as of some of the reporting, granted, our reporting in Georgia has been skewed. For any of you tuning in and you haven't been aware of this, Georgia, up until it was called out 3 weeks ago, they were only recording positive COVID cases of those who had COVID tests in the hospital. They weren't reporting private labs. They're only reporting cases when you were hospitalized and you were tested. So let's say you got tested, felt really bad 5 days later and go into the hospital. You're a COVID case, but because they didn't test you, you don't count in the numbers. It's insane. So, I mean, there's this skewing of data. So the fact that we know based on the skewed data, 85% of our COVID patients hospitalized in ICU and on ventilation in Georgia are Black African Americans here living in all over Georgia. We have Albany, a big cluster in the southwest, and we have a cluster here in Metro Atlanta. This quantity, this number of the Native Americans, I don't even know what that does in skewing our numbers. They're not producing those. There's no way for us to get those numbers. And so there's just a lot, but clearly they've got the numbers. So the fact that they've got something to substantiate this data, but we, on the other side, the consumers, we don't know that number. So, it's one big frustration. Let's see. Joanne, let's see. Oh, good. Joanne loves Sarah's masks. Yeah, they are great. Love them. And Sarah's producing, she told me she hasn't had a few sales and is like totally stocked up. So you order from her this morning, she'll be shipping them out today. You'd probably get them Monday or Tuesday. Lori, Dr. M, just wondering about updated info on surfaces and air, starting to work cleaning again with mask. Hate to be a pest. So there was some data, and I didn't report on it. The CDC highlighted that they didn't think that the transmissibility was as extensive. There's been no changes to the fact that we know that it does live on surfaces. The big question still that we don't know, so I don't have the answer, is that the respiratory droplets that are active on a surface, we don't know if they're transmittable. So they've erred on the side of, well, it's okay, you should be okay, they're droplets on surfaces, but it does live on surfaces. That has not changed. So let's see. Monica, I haven't slept all night, insomnia. I'm diamond painting because I've been stressed out and I lost a day. Thought it was Sunday. So I think the show was on today. Oh, Monica, I'm sorry. Let's see. Oops. Somebody's calling me. Sorry, you guys. Okay. Pao, Dr. Melissa, can you share a link for the N95 masks? It's down below. So if you click on, I think I posted, it's a second link to, let's see, the company, it's Easy Healthcare Corporation. And you can click in that and they'll send it to you. And they're really beautiful blue little masks, and they've got the little wire over your, the little rubber band over your ears. Okay, let's see. Let me answer some questions. Good morning, the Giving Gazette. So nice to see all these familiar faces. Lori's going to start cleaning. Let's see. Let's see. Kay Kaiser, 1972. I thought the WHO said masks aren't necessary. Well, they changed their tune based on data, and they're delayed. The CDC's posted this information along, weeks and weeks ago. So you wear one whenever I'm in public, but the information whiplash is a real thing. It is, but I also want to highlight, and I know you guys get frustrated. I do too, but we have to remember, let's set our expectations. We're dealing with a novel virus. We have never seen anything like this. It is so expansive. It has killed almost 500,000 individuals. It will. By July, will probably be over 500,000 deaths, especially if Brazil is on that incline. We need to have a better expectation, not better. We need to have a lower expectation of what to expect. Does everybody know all the answers? No, we don't know a whole lot. We're still learning. There's a ton of science and data and research being done as we speak to try and figure out, how do we approach this medically? How do we have treatment plans? How do we communicate safety guidelines to the community? How do we even get a handle on the vaccine component? There's just a lot of information we don't know. And I know it is, especially now, we're in this digital age of immediate gratification and immediate data and information. It's a really weird, troubling phase to be in when we just don't have the information. And I know it gets you guys frustrated, and I know you want me to give you all the answers. And I report everything as I'm reading it and seeing it coming out and digging into news. But there's just a lot that we don't know. And we have to, I know it's hard. It's the antithesis of human nature. We have to be settled and okay with that. But with that being said, take all the information I equip you and report every day. This is an opportunity for you to take these resources, the tools, the information, and follow through with it. So, now we know asymptomatic carriers. One, we know they're more contagious, or they're contagious for a longer period of time. Why? We don't know. For how much longer? We don't know. But we see in data that they are contagious for more than 14 days. We'll learn more, but you just need to go with what we know now. The other thing is that we also know that the asymptomatic carriers showcase changes in the lung tissue, even without any symptoms. So the fact that asymptomatic cases are all good, that's not true. And I'd love to see a bigger swatch of all of these people that have active cases that are asymptomatic. I'd love to see CT scans of their lungs. Let's get a bigger sample size. That's probably in the works. I mean, what the beauty is of research and information creates more questions, creates more research, creates more questions. And there's the hypothesis and problem solving and solution seeking that clinical research yields. That will drive more information. Just like yesterday, I reported that there is a study that was triggered by research that had been seen in China about Pepcid as being a bizarre, over-the-counter type of preventative. I won't say preventative, but it definitely has been seen. It was studied or presented in a report where it said all these cases that had, lower fevers, lower hospital stays, recovered, happened to be taking Pepcid. They saw this commonality. That then triggered these two clinicians in Northwell and Cold Spring Harbor Lab in New York to run more information. And they came out with more information about the fact that this antacid might be blocking some of the cytokine storm inflammatory state of the lungs and the stomach. So that is just an example of like one little tidbit triggers more information, more research. And we're just not in a point where we know everything. We won't. We need more time. And unfortunately, the time, if people are not paying attention and tuning in to how this is evolving, how our news and information is evolving about this, the more research we have, they are not going to be aware that now you need to be fully wearing masks because asymptomatic carriers are going to be transmitting this virus beyond the 14-day quarantine time. And even recovered cases might still be contagious. And that is something that we are seeing that pairing early on. Back in March, I was reporting, in the fecal matter and then also the respiratory droplets and like, the larynx type of swabs. They identified that there were still active viral particles in the shed, and those were contagious. So they knew that up to 59 days. 59 days is a whole lot longer than 14 days, 2 weeks. So that might also pair up, but we need that to come in from different angles. So these are two resources that everybody should have. You should have this anyway, especially if there's any case history of heart disease, high blood pressure, heart attack, stroke in your family. Get a blood pressure cuff monitor. Don't go into your CVS or count on Walgreens to be your source, because sometimes those machines are out. They're not always calibrated. These are critical, and you always want to do your left arm, and you want to make sure you're hydrated and do not take it after a meal. It's best if you have a healthy, solid bowel movement before you take your blood pressure. That's another factor. You want to make sure you're seated, you're not talking while you're doing your blood pressure assessment, and also that your legs are not crossed or your feet are not crossed. So that's a lot of information. I know you guys are going to probably digest this quite a bit. Alexis says, have they looked at people who have had pneumonia or bronchitis before and how COVID affects their lungs? I have not seen anything specific to that. But I do know that depending on the bronchitis and pneumonia, the repeated type of cases, or even asthma, there's possible scarring, which can impair the tissue itself. The one thing that I did see a little reporting is that asthma was not as critical of a case as we had previously thought as an underlying health condition. It's the high blood pressure, diabetes. Those are the two big underlying conditions that are a trigger to the cytokine storm. And we didn't learn about the cytokine storm until, we were in it at the end of March, early April. Kay Jefferson, Amazon and Target and Costco are sold out of Costco. They must have known for a while. Let's see. Valerie, hey, I love your show. My question is that I have a operator that has been tested 3 times over almost 2 months and still reports being positive. Do you know why? It could very well be that aspect where we know if you test positive, individuals in the hospital, they'll be hospitalized for 3 to 4 weeks, sometimes longer. So it is not 5 days and done. This is has a long impact on the body. So it's possible that their immune system is just really, really bogged down. Valerie, there's a lot of variables to that, and I just don't know the case of that individual to really see. But more than likely, there's probably some underlying inflammatory related factors, underlying maybe genetic predispositions to, the blood clotting, the higher risk categories. Oh, thanks, Letitia. Please thumb this up if you like this content. I really appreciate that. Let's see. Also, yeah, cupcake paper. Also, if you had blood work in the arm, use other arm for blood pressure. You meant sold out of Pepcid. Oh, interesting. Pepsid is sold out. Yeah. I honestly, I am now less tuned into the news. I just don't have time. And I'm not even tuning in as much socially with the mommy camp that we're doing. We survived 2 weeks mommy camp. No cries yesterday. And we made a little rocket ship yesterday. And it was the best thing you said happened all day. So that's exciting. It was a yucky, rainy day all yesterday. So that was real fun. Let's see. Mary Lou, that's why I'm concerned. I've had bronchitis 4 times and pneumonia once. Finally started feeling better for 2 years with no more bronchitis and now this new virus. That's why I'm being careful. Yes, I totally get it. The other thing that we equipped ourselves with here, I bought a nebulizer. Oh, Valerie, $9.99. Thank you, Super Chat. I'm so grateful. You totally didn't have to do that, but that totally makes my morning. The Super Chats they're so beneficial in supporting my time with you all here. So I'm grateful. It really does support the local business owner. So thank you. That is very interesting, Kay Jefferson, about the Pepsid. And I wonder too, now here's the other thing. This might be sold out or not accessible because of potential supply chain challenges. It also could very well be that some of the communities that knew about this, like China's study was way back in January, they might be absorbing all of that. I don't know. There's probably some backstory. I'm sure we might find out. We may not, but it's interesting. How about COVID and anemia combined with asthma? Those two conditions together are long-term silent killers. I haven't seen anything specific about anemia. But the anemia, there's a lot of different reasons for anemia. If there's anemia that's related to MTHFR or gene mutations, that could be an underlying factor. The ferritin levels are one of the biomarkers. So that is one thing that we know, that 12 or 13 biomarkers I reported, now they're starting to test when people come in. They're running C-reactive protein levels and all these other kind of inflammatory levels, IL-6 that I reported the other day. What are you saying about a nebulizer? So a nebulizer is something that you can have at home. You can nebulize your medications, but you can also nebulize colloidal silver. You can nebulize, the saline, like when we were at the salt spa. So there's a lot of things that you can do with the nebulizer if you find you are still dealing with some of the asthma, bronchitis. Are Tums equal to Pepsid? I don't know. I am not a consumer of those. And I know Tums are just calcium. It's chalk. You're eating chalk. That stuff is disgusting. Pepsid, I think, is different, but I don't know why. I need to look at the chemical composition and look at the ingredients. Okay, so Kay Jefferson says, yes, true, because the supply chain, I've had difficulty finding other supplements or regular OTC products. Glad to see Full Script. Yes. So I will tell you, Full Script, if you guys want to support me, support my channel, support my efforts in giving you guys all this great content every day, Full Script is my supplement store. It's not just mine. I don't own it. I don't manage the website. It's not my business, but they connect in with practitioners like myself who do a lot of virtual work and who have a desire to offer more than what I can always stock on my shelves. And so this is a digital way for you to support my business in buying all these different brands, like the Professional Formulas, the Host Defense, all of these supplements. So, and I've got them linked down below. Oh my gosh, Alexis, look at all the super chats. Alexis, $5. Thank you. Alexis D, thanks for all you do, Dr. Melissa. And Monica Casey, #1 fan. I love the bouncing emojis. Those are so adorable. He's so cute. It looks like he is a bouncing pear. #1 fan, $9.99. Thank you so much, Monica. I appreciate it. I'm beyond grateful. So Full Script, you have access to thousands and thousands of products, all high quality, professional grade products. You can also find things that you might not be able to find at your Target, Walgreens, and CVS that are in the more kind of natural bent. Like you can get your Bach flowers there. There are skincare products. You can get, things for bacterial infections, like vaginal bacterial infections, all different types of things, skincare, hair products. for men, women, children, all your vitamins, all your nutrients, all of those, protein bars, protein powders. We have everything. There are 2 warehouses, one on the East Coast, one in Arizona, and they're constantly shipping out. It's usually 2 days that they ship. And I actually have a rep who works closely with me. She usually watches my live shows during the week, and we are constantly communicating. So when I recommend products, they know I'm recommending them. And I try and collaborate as much as I can with them so they have stock of what I'm recommending. So like Inflamex was one of the ones that I recommended, I think earlier this week or maybe last week, I don't remember. But this is another product that often will have 30 or 40 folks want to buy product. Sometimes they'll say it's out of stock, back ordered, but once you put it in your cart, they'll fulfill the order. And you can do monthly orders, so you can have an auto ship. So if you are like me, sometimes I run out of things and I hate that and I forget. And so you just put it on auto ship and you always have that supplement or vitamin always coming your way on a certain time of the month, and then you never run out. So it's so fantastic. Okay, so that's my little spiel. I don't usually rep that, kind of highlight that, but I also offer 10% off across the board. So there's no coupon code needed. When you click on any of the links down below with the supplements, we just need your name and an email address. That sets you up with a patient account. So if you ever DM me or said, hey, I'm really looking for X, Y, and Z, I can script you products. So I can email you some recommendations with more details. It's part of the HIPAA process. So unlike your normal ordering system like Amazon or whatnot, why we need your email, it's secure and you have your real name. I've had people put in their fake name. So it'll send, it'll send however you put your first name and last name. That's what's going to go on the shipping label. And I've had some calls with some of my staff going, are you sure this is a real person? And it's because I get it. People are very cautious, but very, very positive. I love the company. It's really great. Kaiser, I thought okay. So how about the N95? So the layers, the mask layers are great. The jumping number 1 fan is super cute. Kaiser, my county has seen a dramatic increase in cases in the last 7 days. And I feel like people in my community are kind of over it and aren't being careful. It's so frustrating. Yes. So it's COVID fatigue. We have a certain capacity to handle info. There's a subset of people who still think it's fake news and completely unreal. That is its own subset. There's people that, are greatly impacted and have a lot of fear and anxiety, just want things to go back to normal, to BC before coronavirus. That won't ever take place. The world, we are in a change. We're in a paradigm shift. Okay, Queen of Sheba is in Belgium. It seems like strange to order meds from America. Honestly, FullScript will only ship to folks who live in the US. So that is the other thing. If you live in California, anybody orders will probably see California labeling. So a lot of times they'll have California requirements of labeling certain things. Sometimes that scares people. It's just part of California. It's its own entity. Okay, so dry eyes from the virus. They're seeing more eye impact with children, like pink eye, irritations, crustiness, things like that. I thought today was Sunday. Yeah, I know, it all blends together. All right, so my Inflamex will be here Monday. Yay, Kate Jefferson. Hopping over, YouTube's buffering. Oh no, I'm sorry. YouTube. Okay, so here's what we're going to do. Joanne says colloidal silver 100% is diluted. Ideally, your colloidal silver should be 100% undiluted. But okay, so tomorrow is Sunday. I'm taking Sundays off. Next week might be our last week of live shows every day. I might be going live on Saturdays. Once next week kind of goes, the reason for that, next week's the last week Brian's fully at home and entertaining Gabriel while I work with you. It's a team effort, so I never do anything by myself. And I will be by myself after the 15th. So as a mom, I put him and his needs always number one above anything. So it might be something where Saturdays are just our live show. So just stay tuned. Monday we'll be live, and look for info. I'll poll you guys, and I'm grateful for your time. Instagram, you guys are going off. I'll see you guys on Monday. Okay, so and now let me see if I can save it. Download video. Okay, so I'm downloading Instagram. So YouTube, thank you. I know, Nancy, I will miss it too. And we'll have to see. I've got to figure out how that's all going to work out. And, the first week of Mommy Camp was awful. Second week, we've gotten a little bit better. I've kind of backed off of like my bullet points of everything we need to do. And it's definitely a collaborative effort with Gabriel and I, but he's doing really well. And we're just experimenting to see if this is something that I could do and still try and run a business. Granted, the business is like not really a full functional operational sense since the clinic isn't open. But we'll see. So I appreciate your flexibility with me to try and hash this out. It's just the life of a working mom. So tomorrow we're actually going hiking. We're going to get up early. There's a waterfall in town. We've talked about going and we've never done it. So we're going to get up early before crowds are there. We're going to take one of our dogs. We don't know yet. We're like battling based on my lazy dog who needs to lose some weight and our flat-coated retriever who's so good. She can go off leash and she's so wonderful. So we may take them both. The puppy stays home. But wish us luck. We're going to have a great weekend here today. I've got a lot of cleaning and organizing to do. And I hope all of you have a wonderful weekend. Just be safe. Do order some of the items down below. Equipping your lives and families with these tools, not just for COVID, but overall, this is for your long-term health. And your health and wellness is worthy of that investment. And it can help you also work closely with your doctors preventatively. And if you are concerned about taking medications just kind of on the fly because your blood pressure might be high because of the white coat syndrome, this gives you more resources and information and knowledge to provide your doctors with. So I hope that's helpful. I appreciate each and every one of you, Darlene and Letitia, Cupcake, Paper, and Christine, and Monica Casey. Thank you for the live super chats. I am so beyond grateful. Monica and Alexis D and Valerie, you ladies made my morning. So thank you. Happy Saturday, everybody. Be safe and tune in. I'm posting a video later to the private YouTube community. It's on edit form right now, and I will upload it. This is the new toy I got, so I'm excited to share that with you. All right, everybody, have a great day. Bye. Be well. Give this a thumbs up.